So we already know that sensitizing psychosocial factors can also contribute to the onset, the maintenance, and the exacerbation of pediatric DGBIs. And while it's important to consider factors such as the presence of a mental health diagnosis and the coping style of the patient seen in your office, we also know that who they live with, meaning their parents and their caregivers, the psychological and the medical profiles of these parents and these caregivers play a role in disease onset and maintenance. Pediatric patients who are diagnosed with a DGBI demonstrate higher rates of all of these psychological symptoms and mental health diagnoses. And these symptoms may predate the onset of a DGBI, or they sometimes can emerge in response to the persistence of gastrointestinal symptoms. Let's take a closer look at anxiety. So, when we see the presence of anxiety and a diagnosed DGBI, this can be a complex situation. We know that both of these diagnoses are associated with autonomic nervous system dysfunction and heightened states of arousal. So, when an event occurs, whether it be a pain related event or something else that invokes anxiety, we know that the fight or flight system is activated and that it's more difficult for these patients to return to a level of baseline. So over time, GI symptoms may start to be perceived as threatening, which in turn leads to a higher level of hypervigilance and consequently maintains that cycle of arousal and that nervous system hypersensitivity. Now, we also know that poor coping styles can emerge, including what's called catastrophizing, or imagining that the worst possible outcome is going to happen, and a patient starting to feel hopeless about their symptoms because of this. Not only do we now know that anxiety in and of itself can contribute to the maintenance of pain symptoms and increased disability, research has also guided our understanding that it's actually this element of catastrophizing that serves to explain the relationship between anxiety and the severity of GI symptoms.